Hello everyone and welcome to this audio podcast. This is the sort of ending or closing audio podcast as part of this series, this Bostix series. This audio podcast series is part of a LaBox Infaction. This audio podcast is part of a Storm Quota, and this audio podcast as part of a Storm LaBostics production. So in this audio podcast, the sort of conclusion, if you like, as part of this sort of drafted works from early 2023. CKD patients or chronic kidney disease patients have been sharing lived experiences and understanding between two renowned online or social media platforms to inform decision making, and using social media platforms as sort of space have importance where patients have limited opportunities to share challenges and communicate. The international retrospective investigation informed the need for patient and healthcare professional involvement to support patients through social media and or online space. It is to be appreciated that without allied health professionals or AHPs being available online, peer support alone potentially leads to misinformation. In addition to e-modules and e-learning, healthcare services could be equally enhanced through online podcasts and webinars. Co-developing sort of efforts involving patients and allied health professionals should prompt more joined up care in meeting challenges surrounding healthcare inefficiency. And this is to this is this works was this works was sort of the first international pilot retrospective investigation that examines how a healthcare service provision could be enhanced and informs of a need for patient and healthcare professional involvement through social media and or online space and between pediatric and adult nephrology cohorts. That draws this audio podcast to a close. This audio podcast has sort of references and citations which will be put on social media for anyone checking out Storm Bostix productions and works and where similar works can be identified, and again, this audio podcast series will be available across Storm Robotics production, sort of social media as well.